but it's a lot, and we'll talk about that today, that it was really beyond the scope of a master's thesis project, and really needed a little bit more involvement. So she unfortunately was not able to complete that as her master's thesis project, but we have every intention of bringing this project to fruition and collecting, what we hope is very important data for understanding the role of diet nutrition in PBD-ZSD and related peroxisome disorders. So we're going to talk a little bit about what we plan on doing, going to go into a little the detail of some of the methodology, and Nancy is going to be talking a little bit about that, and then talk about what your role would be, and then what we would do next. So at the end, if you have any questions, or if you have any questions that you want to put in the chat box, as Katie said, please feel free to do so. So I'm going to start by just talking a little bit about, hold on. I'm having trouble moving this forward. How do I do that? There we go. So I'll start a little bit by talking about us first, just so you know a little bit about us. And most of you know who I am, some of you don't, so hi, it's nice to meet you. So I am the mother of Alon. Alon was born in 2010 with a very severe form of PBD-ZSD. Prior to giving birth to Alon, I was actually completing a postdoc in a lab in New York City that studied clinical nutrition and metabolism in gastric bypass surgery patients. So this was sort of a continuation of my training in nutritional sciences at Rutgers University. So that's what I got my graduate degree in nutritional sciences. Throughout the course of Alon's life and afterwards, I sort of walked a little bit away from my research career and joined the GFPD as a board member. And it was through my experience with the GFPD that I started to realize that, my research interests were changing, and I really wanted to do, research that was meaningful to me, and that was rare disease research. So through the GFPD and my network there, including Dr. Rizzo, who was serving on the scientific advisory board at the time, I was given the opportunity to be trained in rare disease research methodologies through the STARE Consortium and the Rare Diseases Clinical Research Network. So now I'm at this sort of point where I feel like I've gotten a lot of training in rare disease research. I could always use more, and I'm constantly learning. I have a background in nutrition, and what I'd really like to do is start, melding these two passions that I have in my research together, and that's, this project is really one of the first steps in doing that. I also would like to introduce Nancy, who is a very good friend of mine. We went to Rutgers together, and we got our graduate degrees together. Nancy has been a practicing clinical dietitian for over 2 decades. She has a tremendous amount of experience in both research settings as well as clinic settings. As Katie said, she's had an experience with a broad range of patients, starting in infancy, going up to geriatric populations. Some of the work that she's participated in has been published in really notable nutrition journals like the American Journal of Clinical Nutrition. So it was, it was pretty easy for me to ask Nancy to be a part of this, because I knew she was more than capable and very qualified in participating in this research. But what's probably more meaningful to me, although all of this stuff is extremely meaningful, is that, since Alon's birth, Nancy and her family have been just incredibly supportive of us, and meaning my family, throughout our journey with Alon and afterwards. And when we held the first Alonathon fundraiser to support the GFPD, Nancy and her family were one of our first family sponsors. And that's actually, this picture here is of Nancy and her 2 boys at the first Alonathon race in 2013. Nancy, do you want to say anything more about yourself as an introduction?
No, I think that covers it. Thank you.
Thank you. So now that you know a little bit about us, I'm going to start just sort of segueing into what we are planning on talking about. So I want to give you the sort of details of this project, but I'd like to start really in talking about why we're doing it, so you understand, you know, why we put this much effort into writing this grant proposal and planning out the study. And it really comes down to what we know about the role of diet and PBD. So at this point, Katie, if you don't mind putting up the first poll that asks about what dietary advice have you been given by a healthcare professional with respect to your child with PBD? So if you guys don't mind filling that out, that would be fantastic. And while you guys are doing that, I will start by talking a little bit about what research is out there with respect to nutrition and PBD. So what we do know is that PBD and related peroxisome disorders can affect issues with growth. We all know this. We know that PBD can result in difficulties with feeding, and we know that a lot of our families rely on some sort of feeding support, like tube feeding, for either some or all of the nutrition that they provide for their child. So I'm gonna move this real quick. All of these things, along with other aspects of nutrition, sort of fall under this this umbrella of nutritional status. So the suggestion here is that PBD does indeed affect nutritional status. So if you take that a step further, there may be some basis in thinking that nutritional intervention may be useful in improving the health of kids with PBD. So that's one thing that we know. Another thing that we know is that, and that's what this poll is showing us right here, is that lots of our families have been given dietary advice for their child with PBD or a related peroxisome disorder from their medical care professional, from their healthcare professionals. And the results of this study, if you're looking at it right now, really supports the big take home that I want to emphasize here is that, yes, we've all been given dietary advice, but it all varies a lot. And really, at the end of the day, as a sort of, not conclusion, but the sort of takeaway here is, with respect to what we know about nutrition and PBD, is that there is no real professional or community consensus on what are the appropriate dietary recommendations for people with PBD. So let's take that and, take that, what we know, there is no professional consensus, and sort of flip it to trying to understand what we don't know. And that's what the next slide is, but I can't forward to the next slide. Bear with me. So, as I said before, there are, what we understand is that there is no professional consensus on what are the appropriate dietary recommendations for PBD. And a lot of that probably has to do with the limited research that there is with respect, I'm sure all of us as parents have heard things like vitanic acid restriction or DHA supplementation or fat soluble vitamin supplementation, just focusing on things like vitanic acid restriction, which, I think there are differing sort of feelings among families as to, whether or not it's something that works for their child. The data out there with respect to PBD in particular is very limited. There's probably 2 papers out there that suggest that maybe vitanic acid restriction will be useful. And with respect to DHA, there's more research out there, but a lot of it is conflicting. So what we don't know is what are the specific dietary factors, like maybe vitanic acid restriction, maybe DHA supplementation, that would be important to consider when you are managing health and diet in your kids with PBD. Sort of, if you take that just a sort of step down, okay, let's forget about vitanic acid and DHA. At this point, some of you may have talked with dietitians in the management of your child's care, so you may have some idea of their overall nutritional status, but as an overall, like as a group, there's no information out there with respect to what is the nutritional status of our kids in detail, of our kids with PBD. What type of nutrients are they getting in their diet, and how much? How much calories are they consuming? What contribution of carbs, fats, or carbs, fats, what's the other one? Proteins is contributing to their diet. That's I refer to that as macronutrients. What is their micronutrient nutrient status? And when I say that, I'm referring to, what type of vitamins are they getting in their diet? What type of minerals are they consuming in their diet? We don't even really have a whole lot of data out there that shows us, on average, this is how much, or the components of the average diet in PBD. And because we don't know this information, we don't know whether or not there are differences in nutrient status or nutrient intake across different feeding modalities. We don't know if there are differences in dietary intake for kids that are orally fed versus those that have G tubes for some or all of their nutrition. And the reason that we don't know a lot of these things is because we don't even know the best way to try to figure out how to collect this information. We don't know the best way to measure food intake. And in our kids, there is very, very limited research out there on how to do dietary assessments on kids that are tube fed. I am assuming it's because the assumption is that they are on formula, and you can easily get that nutritional information from the formula that they are receiving. But we all know that a lot of our families don't exclusively feed their children formula. Some of us are, some of us home blend. So I think it's important to figure out how to do appropriate dietary assessments in kids with G tubes. One more one more added thing to this sort of understanding of dietary assessment is that most of the time with dietary assessments, you are relying if let's say I'm a professional that's doing a dietary assessment on an individual, I'm relying on the recall of the person that's actually consuming the food to give me information on what they are eating. And here, with a lot of our kids, there are communication issues. So the reliance really has to be on the caregiver, on the parent, to give information on what their kids are eating. Okay, so the whole point of this slide is really to show us that there's a lot that we don't know with respect to nutrition PBD. And this is what we have as sort of the basis of our study. But I think before we move any further, I think it's important to address, yeah, sure, we don't know a lot about diet and nutrition and PBD. Why does this matter? Why is this important? So the next slide is really meant to sort of give you an idea of at least what our opinions are on why we think this is important. So whatever your thoughts are on with respect to something like phytanic acid restriction, whether or not you think it's appropriate for your child, whether or not you think it's not, there is some research out there that suggests that if you intervene with something like phytanic acid restriction in other peroxisomal disorders, not PBD, that this can improve symptoms. This is the case with a condition called adult Refsum disease, which is, like I said, another peroxisomal disorder. So there might be a basis for or reasoning for doing a dietary intervention with something like phytanic acid restriction, but we can't do that unless we are able to understand what's the appropriate dietary assessments that we need to do an intervention like that. What's more is that not necessarily in PBD, because again, the studies just aren't there. There have been some studies in pediatric populations that have shown that there is a difference in things like iron status across different feeding modalities, meaning like kids that are orally fed versus kids that are tube fed may have differences in nutrient status. And that's not even something that we've even thought about with respect to PBD in any sort of large way, but it may be something that is important to address if we knew if this were the case. So bottom line, there are no real studies out there looking at dietary assessment in PBD. And I personally think, and I think Nancy agrees with me, in that it's important to understand this because, first of all, it gives us insight into you or us as a group, knowing what our kids are are consuming and how that relates back to their overall nutrient status, how that relates back to their growth. If we think that dietary intervention may be a viable way to improve the health of kids with PBD, then we need to be able to standardize what dietary assessments that we're using as outcomes for these types of interventions. And even if you don't think that dietary intervention is going to be useful to in terms of improving health, if we move forward and we start move forward towards clinical trials with, say, like pharmaceuticals, we have to take into account any sort of drug nutrient interaction, to really control for any sort of confounding variables in any sort of drug trials that we have in the future. So at the very least, it's important to understand what dietary assessment would be appropriate in PBD as a way to control for these confounding variables in clinical trials. So that's really our why in terms of, why are we doing this project? Why do we think that this matters? So I'm going to fast forward ahead to the next slide, and I'm not expecting you to read this. This is actually just the flyer that my university's institutional review board, which is basically a panel of people that look at this study and say, okay, this study is ethical with respect to the participants that are taking part in this study. This is a flyer that they've approved that I am allowed to distribute among you. And I know that Katie had said that she was going to post the flyer later. So you're not expected to read this right now. You will have access to it later. This is basically a summary about what we're about to talk about in a little bit more detail. The one thing I do want to hammer in here before we move forward is that you see at the top, it says Zellweger Spectrum Disorder Dietary Assessment Study. So I want to make it clear that if you are a family that is not necessarily diagnosed with ZSD, but maybe acyl-CoA oxidase deficiency or D bifunctional protein deficiency, you are still eligible for this study. So this is not just limited to people with ZSD. That's just the title of the study. So this is meant to be eligible for families that have children with ZSD or a related peroxisome disorder, and that includes acyl-CoA oxidase deficiency as well as D bifunctional protein deficiency. So the purpose of this study is really to conduct dietary assessment on children, and we want to do a series of this to make sure that these dietary assessments are stable over time. And we want to do these dietary assessments on children with PBD or a related peroxisome disorder using the input of the parents, the family caregivers. And when I say family caregivers, I'm usually talking about parents, step-parents, or any sort of legal guardian. But truthfully, anybody that monitors what a child with PBD eats can be considered a caregiver here in this study. As long as you know what the child with PBD is consuming or being fed or being administered through their G-tube, then you are eligible to participate in this study. And so the assessments that we are going to be doing, that Nancy is going to explain here in just a second, are something called a 24-hour dietary recall, as well as a 3-day food diary or food record. And we are going to be using this information that we collect from you through the recall and through the food diary to analyze overall nutritional status using nutrient analysis software. So I want to just hand the reins over here to Nancy. And Nancy, please feel free to tell me when to skip ahead if I have not done it. And Nancy is going to talk a little bit in details since she's the expert here on these assessment methodologies.
Thank you, Mousumi. And let me just say thank you very much to the GFPD community for letting us share this information. I want to just speak today about the nuts and bolts of this study and what we're measuring and why we're measuring it. The first thing that we will be doing is something called a weighted food diary. And that sounds complicated, but really what it means is that we will be sending all of the participants of the study a food scale for weighing and also a measurement cup for measuring liquids. And we will simply provide you with a document to keep track of what your child is taking in throughout a 3-day period. So believe it or not, I know that this can sound a little bit cumbersome because it does require you to really pay attention to what's going on as you're probably trying to also prepare a meal and make sure that your child is getting fed. I understand that there's a lot going on. But the reason that we do a weighted food diary is because this is what we call the gold standard of nutrition assessment. It's the best way that we have to really make sure we know what a person's intake is. So as I said, it's a little bit time consuming for the caregiver who's doing all the documentation, but it is very specific. The second measurement tool that we're going to use is something called the 24-hour dietary recall. And this is a little bit easier on the caregiver in that it's a call between you and I, probably over a Zoom conference, much like this, in which we will talk about what your child has had during the last 24 hours. And generally speaking, it takes about an hour to do the whole thing in one fell swoop. And it just kind of relies on your memory of what the child ate and what different products and what items. So there's not a lot of measurements and weighing. The reason we're doing both of these things is because in future studies, it would be really helpful to any of the participants to be able to do one and rather than both of them. So what we will try to do is something called validating, which means that we will compare the two, and if they seem similar, maybe in future studies we will only have to do one of these items rather than both of them. Now with all of this data that we're collecting, we are going to analyze them in nutrition software, and what that means is there is a large database of all the different foods that we tend to eat here in the United States, and it will give us the most comprehensive information regarding both the macronutrients, the calories, and the carbohydrate, protein, and fat, and also the micronutrients of the vitamins and minerals that your child is consuming. Can you go to the next slide, Mousumi?
Absolutely.
Thank you. The design of the study is something called a longitudinal study, and that is a long word that just basically means we're going to observe your child with multiple measurements over a 3-month period. Each month will require about a 3-hour time commitment. However, as I explained in the previous slide, that's most likely going to be in tiny increments throughout those 3 days when you're collecting the information for the food diary, and one hour conversation with me at one point during the month. We're going to try to screen approximately 40 participants to determine a final total of 20 different people to participate. And the reason that we're doing that is that we want to try to make sure we have representation from people who are whose children are being fed by mouth only, by tube feeding only, and those in the middle who are doing a little bit of both. We want to try to represent all 3 of those groups because all 3 of those groups are important, and we want to see if there are any differences between those 3 groups. In terms of who is eligible for this study, we are looking for people who have children with PBD-ZSD, as Mousumi explained, who are greater than 1 year old. The main focus is going to be with the family caregiver, and as Mousumi did explain, what we're looking for here is really the person who's doing much of the feeding and perhaps preparing of food. So that's the person that we're probably going to have the most contact with. And that person is going to need to be able to complete interviews via Zoom, food records, and we will do some basic questionnaires in terms of demographic data as well. As far as who can't participate, there are really only two exclusion criteria. The first is children who are currently being breastfed. Given the limitations of our study as a remote study, we wouldn't be able to analyze a particular child's breast milk that they're taking in. So therefore, in this study, just to simplify things, we're going to have to exclude those children. Also, children who are on total parenteral nutrition or IV nutrition are going to be eliminated from this study simply because we are trying to determine the intake of patients who are taking food orally or through a tube feeding. Next slide, Mousumi.
You got it.
Thank you. So the timeline of the study is going to be really quite soon. It's going to be through 2020 through 2021. In just a couple of weeks, in June, we're going to start to recruit and screen eligible participants. We're going to then, in July, August, and September, conduct 3-month dietary assessments. And I think a lot of people are probably saying to themselves, why do you want me to do this 3 times? And the reason that we have to do that is because things change over time, and we want to be able to capture kind of an average of what happens in your child's diet. So for instance, there might be seasonal changes to a child's diet. For instance, in July, maybe it's strawberry season, so you're eating a lot of strawberries, but by September, the strawberries are all gone and you're eating tomatoes instead. When I was trying to think of an example of this, I thought back to my own children, and I noticed that in the last week in my household, we have celebrated a birthday, which included birthday cake and some special foods. It was also Mother's Day, so there were some breakfast pastries and a special dessert. And also, during the middle of this, my children made a STEM project for school in which they had a solar oven in which they were making their own s'mores. So as you can imagine, if one was to look at my children's 3-day food record this week, it would be preposterously high in sweets and marshmallows. And I would hope that the following month, it would kind of average out over time. So that's why we do things 3 at a time. For those of you who are primarily using a tube feeding, you may find that over a 3-month period, you're increasing the rate of tube feeding or the volume, the total volume of your tube feeding, or you may find that you're changing a formula if you have intolerance issues, or maybe you're working with a speech therapist and you're gradually getting a little more food by mouth in. And so those are all we are best able to capture if we have 3 different time points in that 3-month period. Once we're done collecting that data, then we will have all the time to analyze the data using that nutritional database that I referred to earlier. And then finally, once we get to next year in 2021, we will be sharing the results. That means we will share with you exactly what the results were for your child in terms of calorie intake and some of the macro and micronutrients. And we'll also be publishing the findings, which means that your care team and researchers will be able to access that information in the future so that we have a foundation on which to start any future research.
Okay. Thank you so much, Nancy. That was, really, really informative. So since this is me talking about the study, when we're talking about studies to any potential participants, I think it's important to talk about the possible risks and benefits associated with the study. So the first thing I want to emphasize here is that this is an observational study. Okay, we want to know what you are feeding your child and how much of it. So there is going to be absolutely nothing that's going to be changing in your child's diet as a result of this study. The only thing that we're asking is that you measure what your child is consuming. So because of that, because there is no actual change in anything with respect to your child's diet, we we foresee no potential risk to your child directly as a result of this study. The risks, and again, this is stuff that I have to sort of, report to the institutional review board that looks at the ethics of a study, to talk about all sorts of risks out there that may be possible. And here, the major risk here is that there may be some distress associated with having to remember what your child ate over the past 24 hours or within, even a shorter amount of time. So to minimize that risk, again, this is only going to be a 24-hour recall. So when Nancy is interviewing you, she will only ask you food that your child has eaten or been fed over the last 24 hours. We ask that when you do the food diaries, that you try to complete those around the same time that you are feeding your child or immediately afterwards, so it all stays sort of fresh in your memory. But at the end of the day, you're not going to be penalized if you can't remember every single thing that your child ate. We just ask that you do the best that you can. And using these sort of approaches, trying to fill out the food diary as soon as or after you feed your child, and and just really thinking about the last 24 hours when you have a Zoom interview scheduled with Nancy. So at the end of this, you will, as Nancy alluded to earlier, we will have a complete dietary assessment and nutrient analysis for your child. So you are welcome to all of that information for your child. Once we get all of the data together, we will also share with you the sort of like, group findings, like the average consumption as well. So, you will have that information to you, and, you can do with it what you want. This is a research study. It's not meant to be any sort of clinical kind of assessment, but you will have that information for you. You will have that information available to you. And, if that is something that you want to talk about with your physician, you can certainly do that. I think Nancy sort of talked about, the kind of the responsibilities if you decide to participate in sort of measuring your child's food intake, that you may be doing that already. I don't know. And if you find that having a scale and a measuring cup is useful to you, and and you want to continue using that, the scale and the measuring cup, the graduated cylinder, that will be yours to keep, so you can measure anything that you want to once this study is over. And if I do, we both recognize that we are asking you guys to do, a lot in terms of measurement. So as a little incentive, if you complete the 3-month study, we will also be giving all of the 20 participants an Amazon gift card. So that's really the nuts and bolts of the study, as well as the potential risks and the benefits of the study. I will sort of start to close out by talking about what we're going to get out of this. As I said before, you will have a complete nutrient analysis for your child. We will be able to sort of group all that together to get an idea of what is the average caloric intake and macronutrient and micronutrient intake for the kids that participate in the study. And we may be able to do things like relate that back to like things like growth status. Once we have this information, we will also hopefully be able to, since we are planning on trying to stratify our sample to get kids that are orally fed exclusively, kids that are combination fed, kids that are G-tube fed exclusively, and then the variety of diets within those G-tube feeds and oral feeds. It would be interesting to know if there are any differences across these different feeding modalities, and see if that is something that we need to address. With doing the 2 types of measurements, the recall as well as the food diary, hopefully we will get an idea as to what is the best assessment method for any sort of future dietary research studies with PBD and related peroxisome disorders, so that in any sort of future studies, we'll only have to do one of those measurements, either a recall or a weighted food diary. And and having this sort of idea of what is the best assessment I think will be an important step in possibly getting information on what are the dietary recommendations. Now we have a baseline of what people are consuming and what their what the overall nutrient status is with respect to their diet, this might be an important step in trying to get some sort of consensus on what dietary recommendations would be appropriate for an individual with PBD or a related peroxisome disorder. And also having these sort of measurement approaches sort of standardized or at least validated will set the stage for conducting any sort of future dietary intervention in PBD and other related peroxisome disorders. So, I think the appropriate next slide would be, so what comes next? So if after this you are interested in participating in this study, one thing you can do today is send a private chat to the GFPD. I know you can send it privately with your email expressing interest, and then we will follow up with you and we will give you a consent form that we will be happy to go through with you via Zoom conference on the different, the different aspects of the consent form. Once you've read through the consent form and you are okay with it, we will ask you to sign it and send it back to us. And then once we have your completed consent form, we will follow up with a link to the screener survey via email. And then once we have all of the participants participate in the screener survey, we will choose our 20 to participate in the longitudinal study, and we will contact you as well as make plans to ship you the supplies, meaning the scale, the measuring cup. We will also send you a tape measure because we will ask questions about the height of your child, and then we will work with you to schedule your first Zoom conference with Nancy. So that's really all I have. If you have any questions, before you decide that you are going to, that you are interested in participating, you can always email me here. And I know Katie and Mel will share my email with you if you have any